Hello, I'm Phil Mollon, and I'm inviting you to join me for the next ACEP conference, Multiple Dimensions of Psychotherapy and Healing, this coming May 31st to June the 3rd, near San Diego in California. It's going to be wonderful. ACEP is the Association for Comprehensive Energy Psychology, the professional body for the exciting and innovative field of energy psychology. Their conferences are always excellent and groundbreaking. In my workshop at the conference, I'll be presenting 2 new techniques for releasing the patterning of traumatic stress and the dysfunctional patterns of thought, emotion and behavior that have arisen from adverse experiences. Lung meridian breathing and internal eye movements. These are very easy to learn, deeply effective, and I'll tell you how to use them for maximum benefit and how to link them to more familiar psychotherapeutic approaches. Let me give you an idea of the lung meridian breathing exercise. This came to me as a chance observation whilst I was exploring the therapeutic use of the meridian alarm points. These alarm points are different from the usual treatment points where people tap or press in methods such as thought field therapy or emotional freedom techniques. What I noticed was that the lung meridian alarm points seem to elicit and release emotional distress in a particularly potent way. Now, this video is intended for practitioners of energy psychology or professional therapists who wish to learn these procedures. If you have experienced extensive trauma, please do not use this method on your own. Please only work under the guidance of your professional practitioner. Also, please do not use this method if you suffer from relaxation-induced anxiety. This is a very common reaction in people who hold a deep belief that it is not safe to relax. For such people, a stress-relieving procedure is likely paradoxically to induce anxiety. And of course, none of what I describe here is intended as a treatment for any disease or any condition for which you should seek attention from a medical or other health professional. Now here's the basis of what I will present at the conference. If you cross your hands like this over your chest, with your fingertips resting in the hollows of the shoulders, which are actually in the lung meridian alarm points, and your thumbs can just rest naturally on these K27 points just under the collarbone. And in that position you're getting a nice cross flow of energy, and your breathing will naturally start to release stress just by holding your hands, your fingertips in that position, and just following the instruction of let your mind and your breathing do whatever it wants. Just let your breathing do its own thing. It may go faster, slower, deeper, shallower. Just let it do whatever it wants, and it will release the stress. It's quite an amazing method in its simplicity and its effectiveness. Now, stress and trauma seem to be patterned into the breathing. Often when people recall trauma or approach in their mind an area of great distress, their breathing becomes constricted. The flow of the breath is stopped. If the person is invited to hold their hands in this position and let your mind and your breathing do whatever it wants, the stress and the dysfunctional patterning resulting from adverse experiences is discharged. It's very simple, very gentle, and very natural. And in the workshop, I'm going to describe how to use this in a clinical context, how to guide and target the method on the client's most crucial experiences and conflicts, and how to embed this in a broader psychotherapeutic approach. The second technique I will describe, internal eye movements, grew out of my experience as a practitioner of EMDR, eye movement desensitization and reprocessing, which is a very effective and now widely used method. I've practiced it for many years. In fact, I wrote a book about it called EMDR and the Energy Therapies, Psychoanalytic Perspectives. Now, although we do not really know how or why EMDR works, one aspect seems to be that it engages different parts, different areas and functions of the brain, thereby facilitating the processing of trauma. In an effort to engage even more areas of the brain, I began to explore the use of internal imaginary eye movements. And these seem to make the processing even more effective. From there, I moved on to working with spinning imaginary eye movements. And these seem to enable the generation of spinning energy fields. And there are ways of orienting these to re-establish natural energy breathing, so that stress is continually cycled out of the system and new resources continually cycled in from above. So they go out below and they come in from above. They're a bit related to Merkaba fields and torsion fields. The procedure is too complex to describe here, but I will give a full account of it at the ACEP workshop. One of the ways this procedure is very safe is that, used in the way that I teach it, the client does not need to dwell upon trauma. The trauma is accessed just briefly. As any clinician who's worked with serious trauma will know, one of the hazards of psychological trauma treatment is that the person becomes more traumatized and destabilized as a result of the treatment. But I think that danger is minimized with the method that I will describe, at least in my experience. I'd like to talk briefly about the overall approach I've developed called Psychoanalytic Energy Psychotherapy, or PEP, which I've described in detail in my book of that same title. It arises from my encounter with energy psychology, having been rooted for many, many years in psychoanalysis. The more that I've studied energy psychology, which has been for about 12 years now, the more I have been astonished by its congruence with the phenomena reported originally by Freud over 100 years ago. Freud wrote of energy, he called it libido, and of this energy being at the interface of the mind and the body. This is very similar to our contemporary awareness of the subtle energy fields of the body and how these express the thought fields of the mind. What we now know that Freud did not know, and this is through the pioneering work of Dr. Roger Callahan, that has been lost in some of the later simplified derivatives of his work, is that these energy psychology, these energy fields contain information that is encoded partially digitally as sequences of on-off meridians. We can learn to read these, and we can learn to follow the flow of energetic information that is synced to the flow of psychological material. as therapists, we listen with free-floating attention to the client's free associative speech. And we read the energetic countertransference in our own body. Since we are communicating energy fields, rather than beings who are isolated and insulated within our physical bodies, client and therapist form one field of information, so that relevant ideas, words and insights can arise anywhere in that field. In the client's mind or speech, in the therapist's mind or speech, or somewhere in the discourse between them. Although this approach is not psychoanalysis, as generally recognized, we can relate it to interest in recent years in field concepts within psychoanalysis. And of course, Freud was very interested in telepathy, but he could find no place for it within his theory. Well, the field of energy psychology is certainly exciting and endlessly fascinating, as well as providing therapeutic possibilities unimaginable in older psychotherapeutic approaches. And the ACEP conferences always bring the best of these, a synergy of many domains and dimensions of knowledge and practice. It is, in my view, not an exaggeration to say that the best knowledge of psychological healing currently available on this planet is to be found at the ACEP conferences. I hope to see you there. Thank you.